I am pleased to report that today, 6,754 Albertans have recovered from COVID-19, leaving 371 active cases in the province. Currently, 42 people are hospitalized with COVID-19, with 6 of these in ICUs. Proactive testing is a cornerstone of Alberta's relaunch strategy as we move safely into Stage 2 this Friday. We have now completed more than 310,000 tests. Out of 6,582 tests completed in the last 24 hours, there were 47 new cases. Thank you to everyone for getting tested, even if you did not have symptoms. In the last 24 hours, there have been no deaths in the province. The total number of lives lost remains at 151. We must always remember that COVID-19 can be fatal and that many families have been devastated by this virus. I must also report that there has been a small outbreak in a unit at the Alberta Hospital in Edmonton. 4 staff members have tested positive to date. No patients have tested positive. AHS has taken swift action to implement outbreak protocols and ensure that all staff and patients are being tested. Testing lets us take action quickly to make sure that all are kept safe. As we move towards Stage 2, I know that many Albertans are looking forward to more activities. I know there are students who want to take their diploma exams, and schools and school boards eager to make that happen. I know many are excited that we are now able to safely reopen recreation centres, libraries and theatres, participate in arts and sports activities, and attend some cultural events. I also know that many other Albertans are feeling anxious about this reopening. It is important to remember that both responses are natural and valid. We are in a time of balance where we need to balance the needs of some Albertans for the reopening and the needs of others for safety, and we need to hold those together in tension. This virus is still with us, and I remind all Albertans we are the best protection for ourselves, our friends, and our neighbours. Indoor gatherings can now include as many as 50 people while staying 2 meters apart. For outdoor gatherings or seated audience events, indoors or outdoors, the maximum is now 100 with appropriate physical distancing. We have posted guidelines, but it is on all of us to apply them to whatever gathering we are organizing or attending. The same goes for other activities, such as worship services, that no longer have a cap beyond the number that can be accommodated while ensuring that physical distancing of 2 meters is in place between households or cohort families. I urge all organizers to apply the available guidance as best you can and in every possible way. Stage 2 is an important shift for our province, and I know that many questions exist. We posted guidance documents and will continue to expand this information in the coming days. I want to emphasize that no businesses or services are required to open this Friday. Reopening should happen only when they are ready. We are hopeful students can return to learning in school in September in a way that's close to normal operations. Important hygiene measures will be in place: cleaning and disinfecting, routine screening for illness, a stay-at-home policy for staff and students who are ill, and physical distancing wherever possible. Students may be grouped in cohorts, and rooms could be reorganized to create more space. Masks would not be required, though they could be used if a student is ill or in cases where physical distancing is not possible. One of the things that we were looking at as we were developing the public health part of the school reentry plan was again looking at balance, and this is a common theme of relaunch, is that we know that there are consequences to having children not able to be in school. We know that there are risks to those children. We know that there are some consequences for broader society to having a universal distance-delivered education model. And so we need to balance the risks of continuing that distance model or the risks of bringing students back to school because there is no one risk-free option that we have at our disposal, unfortunately. So we're seeking that balance. And what we're saying with respect to distancing is that in some of the younger grades where it may be more challenging to have students distanced at all times, we do have some recommendations about how desks could potentially be arranged to limit the possibility of transmission while students are seated in desks, how they could potentially be how the activities could be structured when they're not at desks, and then using more of a cohort model again. So when children go back to school, especially children in the younger grades, if they can be kept within the same cohort of children, if there is an exposure, it limits the total number of people who could be exposed and limits the ability of that to spread beyond. So we're using multiple layers of protection. Distancing is one element, cohorting is another, making sure that there's regular screening so children do not come to school when they're feeling ill, when staff or teachers also have that regular screening that they're not coming to school when ill. So there's no one single intervention that's going to prevent spread. We have to layer all of them on top of each other and again balance the risks of coming back to school in person with the risks of students staying home. Because again, there's no one perfect option and we have to find our best way through this, balancing all of those risks.